Your survey, we asked you what areas of practice advanced trainees often struggle with. So that was, and we're going to ask you to talk about that in a minute, but these are some of them. So these are some of the content areas. And so before we can think about any program of assessment, we have to think what is the areas we want to assess. And we don't just want to assess the easy things, we want to assess the important things. Sometimes they're easy, sometimes they're not. So we're going to get you to talk about that. I'm not quite sure how to interpret this. Research was right at the top there as an area that advanced trainees struggle with. Health policy systems and something or other, and communication and leadership, I guess. So they're big areas. What you'll conclude already is that they're not easily assessed by exams. So we just need to think about that. So no one ever said this was going to be easy, but they're really important areas to get our heads around. So that's what you told us, and we'll get you to talk about that in a minute. We also asked you to talk about what it was that contributed to failure to fail, and you came up with a lot of the right answers, I might just say. So you talked about aspects related to the trainee, and if I can interpret this correctly, so there's obviously things about their learning, their professional skills that they may or may not have learned as well as they should have, communication, insight. The fact that there might be something about the trainee that makes you like them, we'll come back to that, and therefore they're such a nice person, how could I possibly fail them? And I guess what people are getting at there, and I'll be interested in your thoughts around borderline performances. Sometimes these decisions are really difficult. Sometimes people, they're just above or just below, and perhaps we'll just let them through. A big one I've heard is the fear of repercussions. If I fail, does that launch an avalanche of paperwork? And that can really put people off. And the remediation side of things as well. So we will talk about that in more detail. Failure to pass, sort of similar things. So people who failed but should have passed. So they're people who are actually, you think in general are okay, but they should have passed. And there's similar sorts of themes. We'll come back to those as well. So what we're going to get you to do now is we want you to look at those results, and you've already thought about that as well. And in the tables, we're going to get you to think about those areas so that, because once again, the purpose of this is to get all the problems out there so that we can work out what it is that is the problems with the trainees and what are the problems with the system. The two broad areas, the problems with the trainees, problems with the system, that inhibit us doing the right thing in advanced training at the moment. So we would like to do that, and you've got about 40 minutes, although we will also have some feedback in that time. So we'll call you back before then just to have some feedback on how you get on. So in your tables, talk about that, have a think about those things that we got on the pre-survey. You might still think the same thing. There might be other things you're thinking about now. Think about those broad areas, and then we'll have a chat in a few minutes. Mitra, yes, please.
If I may. I think the one that is probably difficult is that last one, not passing a trainee who has a satisfactory performance. What do we mean by a satisfactory performance? Because I suspect that if a trainee is being failed, there's some aspect of their performance that's not satisfactory. I mean, people wouldn't do it out of malice. If you see what I heard, at least I hope not.
Yes.
So I think we need a definition of what is satisfactory performance for both failing and passing.
Sure. I think that's right, and that comes back to the standards. What is it we're expecting? And I think that's a really important thing. To be honest, I suspect this is not a big one. I suspect it's failure to fail is our biggest problem rather than failure to pass.
Again, the satisfactory performance needs to be defined there as well.
Yeah. I mean, I think it might occur, if it does occur, the failure to pass might occur, and I've heard this anecdotally around the basic training. So some of our exams at basic training, I've heard the anecdotes. They're such a great trainee, how could they fail that exam?
Ah, that's a different kettle of
fish. It is, and it's not a subject for today, but I think, I'm not sure, I'd be interested in your view. I suspect failure to fail is a bigger problem than failure to pass in advanced training, but I might be wrong. Yeah. Okay, go to it, and we'll get you back in about 20 or 25 minutes.
what is it? What is it about? Can we have the graph up?
So just to remind you of the task, I don't know if your table was like our table, but we sort of covered quite a lot of ground actually. But for now, the task is mostly to think about two issues. One is the attributes of the trainee that you think causes difficulty, and the other is the attributes of the system that causes difficulty. And then this afternoon, we can use both those pieces of information to, once we define the problem, it's easier to work out whether the solution is the right one or not. So this is mostly around defining the problem that we're trying to sort out. So, rather than necessarily every table sort of doing a formal presentation, I'm happy for you just to call out things and then other people to add to those thoughts as we go along. But what we might do for a start is we'll keep it in those two categories. So the first one is the attributes of the trainee that you find difficult, that you find it difficult to fail people on. So the attributes of the trainee for a start. So have some random thoughts from any of the tables? Or not random thoughts from any of the tables?
But there's the same things that came up in the bullet points. That, for example, professional development, people were fairly well selected technically and fairly well instructed technically, but perhaps both the trainee and the system were less well equipped in terms of professional development, leadership, policy and governance, research projects, those sorts of things are the areas where. Yep.
So I like the bar chart, Matt. So there's the sort of the professionalism one, I guess, is a big one, but the research one was another one, I think I hear you say. Yeah, yeah. Okay, other thoughts about that? What are other areas that we find it difficult to fail people on when we actually should have failed them? Yeah.
Along the same lines, things like ethics, reliability, professionalism, communication skills. It's very hard to sort of put a black and white ribbon on something like that to say, he didn't know X, Y, Z fact, therefore he failed.
Yep. So that's that. Okay, reliability, professionalism, that's another good topic. Yep.
I just think those professional things are often quite difficult to observe. We're not very good at observing leadership because we're observing it and we tend to be the leader. So trying to get your trainee to be the leader when you're with them is actually quite challenging. And similar with things like health policy, etc. Trying to observe that in your trainee is very difficult.
Yeah, I think that's a really good point. It sort of raises another issue to my mind is defining what these things are. What is leadership? And what's appropriate leadership at an advanced training level? What does that look like? I'm not sure I know that myself actually, but that could be another area, couldn't it? That yes, we see that this is an area that's difficult, but we don't actually quite know what it is that we're uncomfortable about. Yep. Good.
One of the things we were discussing at our table is in advanced training, the transition through training, that a first year advanced trainee is quite different from a third year trainee. And we thought that there was a number of trainees that had just been let through because, they were first year, they can go on, and someone suddenly in third year says, hang on, this person's not ready to be a consultant, there are issues. And if you look back, often those things were there early on, maybe back to basic training also, and they haven't really been clearly articulated and given the trainee sometimes opportunities to achieve those things. So there's a number of things in there. One is setting the standards. What do we mean by the difference between a first year and a third year trainee? And how do we actually teach that and assess it? And then how do the trainees actually achieve those things and show those? And we had a lot of ranging discussion, but that was that sort of area that we're talking about.
So if I hear you correctly, David, it's more getting the progression of learning right, so that we expect more at the end of third year than we expect at the end of first year, but we're not very good at articulating that. Yeah.
And in a way that brings us to a systems problem, because our assessment tools are exactly the same tool that you use in first year form as in third year. And we need to have a mechanism of saying, we need to have a mechanism that guides supervisors into determining, okay, this is a first year trainee. What level of competency do I expect this trainee to have achieved by the end of first year in all the domains that we want to assess them in? And if they haven't assessed it, then they haven't passed that year. Rather than saying, oh, well, they haven't done it, maybe they'll pick it up in second year. Each year needs to be assessed on its own merits. They need to be able to progress it on their own merit, and not all then suddenly left to third year to say, well, we really haven't achieved that yet. And that's one of the things that we're constantly seeing now.
So defining the expectations, the standard of expectation.
And that those expectations are met before that year is signed
Sure.
off.
Yeah, at each stage of the course. Yes. At the back, and then Mike.
I'm Philip from the SAC in Medical Oncology. We actually guide our supervisors with our mini CXs at gate-based discussions and vary them between first year and third year. So first year, a mini CX would be, for example, consenting someone for chemotherapy, while in the third year it would be transition to palliative care or consenting for a clinical trial. The degree of assessments are really varied to the degree of the trainee, whether they are in their first year, second year or third year. Assessing someone on consenting a clinical trial in their first year training is inappropriate, but in the third year they should be quite confident in doing that.
So I'm getting the sense that one of the reasons why it might be difficult to fail people is because they might have achieved the right level at first year, let's say, and then the heat's gone off. They're fine, I'm doing okay on that, but they don't increase their learning in that area. And so then suddenly they get to third year and someone suddenly realises they're still at a first year level and no one's told them. That's the sense I'm getting from this. No?
Yes and no. I mean, it's more that people, I mean, I think it's very rare, unless there's been a major catastrophe or a personal circumstance, for a person in third year to come up with problems that have not been identified in 1 and 2. But the problem that often happens in 1 and 2 is they'll say things like, well, they've only just started training, perhaps with a bit more time, a bit more experience, they'll be okay. Yeah. And it just keeps getting passed up without actually action taking when it should be.
Okay, thanks for that. It's related, isn't it?
Yeah.
So that you excuse them.
You excuse them.
In the first year because it's only their first year. And then someone excuses them again in the second year because, well, they've got through first year. Yeah. Okay, good, okay. Mike?
These are actually systems issues. And although we've split them into trainees and systems, nearly all of these, with the exception of experienced leadership and being a leader, so that's something that might be a training thing that they just haven't had the opportunity to do, but everything else about recognising the diversity of training, the progress of training, the opportunity to say, if only this, this and this, that's all about the system. That's not about the trainees.
Thanks, Mike. That's probably a good segue, isn't it? We will open it up for systems things. What I was thinking, in a minute, what I was thinking is that we might, I think we've heard enough to say that the content area that the trainees struggle with are those difficult, traditionally difficult to define areas like professionalism, leadership, communication and so on, because they're sort of regarded as a bit softer, hard to measure. Of course, we're getting much better at making judgments on those things. But yes, you're quite right. We'll talk about systems things in a minute, but just at the back.
I mean, I'm a general peds trainee, so I'm not speaking for trainees, but speaking for the table. One of the issues that came up was, as a supervisor, a difficulty providing feedback to a trainee that has poor insight into not doing well, or areas of needing improvement. So I don't know whether or not poor insight could be a professional quality, but I think that was one of the issues that was raised by the table as a trainee issue.
Yes, there's a general theme, isn't there, I suspect, around the relationship between the supervisor and the trainee that can make these things quite difficult. And I'll come back to that a bit later on, but one of them is where the trainee is not receptive to understanding that there might be problems. Yeah.
Oh, and just feeding on, so we're talking about the systems issue, but I think one of the things that affects trainees, but also all other aspects of the system, is the culture of giving timely and regular feedback and the quality of feedback. And if it's if the culture is, even as a good trainee, that you get 2 positive things plus 2 areas of improvement plus a time to reflect at monthly intervals, that's good as a good trainee, because there's always, everyone needs to improve. So I think the culture as a trainee is something else that's and all other tiers of the system is something that's important to address as well.
Yes, one thing you can almost be guaranteed of getting an answer, the answer you're going to get is if you ask some trainees, are they getting enough feedback, you can be pretty confident they'll always say no, regardless of how much. But I think one of the problems with feedback is, it comes back to that standards thing. What are our expectations? Because if our expectations are clear, and the trainee has insight. And I know that's not necessarily given, but most do. But if the standards are clear, then they can provide their own feedback. They can judge themselves against where they're going. But when the standards aren't clear, and if they think they're doing okay, but someone says they're not, that can come as a complete surprise to them. Yeah. Matt.
The system's for advanced training is very 3-year focused. Whereas in basic training, there's a little bit more flexibility, and there are lots of reasons for that. But that puts a big constraint on what happens.
Yep.
So we had a discussion about trainees where, with a change in environment, they seem to change their level of ability. So if they're moving from one hospital to another or one job to another, and if things are identified in the new job that weren't identified in the old job, what the reason is, whether it's a trainee specific thing, they just got very comfortable in what they were doing and were in a supported environment, and suddenly they're in a different environment, whether it's the environment or the change as to how you interpret that.
Yeah, we'll come back to that. I think we'll come back to it fairly soon, because I think this links in quite nicely with the entrustable professional activity thing. What can you trust someone to do is a decision that we are quite used to making. You know, go away and do that and let me know what you find. That's a decision we make every day. Will I let them go and do that or not? And if they do that, will I trust what they tell me or not? That's just a natural decision we make. So, and I think the other natural decision we make is under what circumstances would I trust them? So I can trust them to do that, but I'm actually just going to be in the next door room, just in case. Or I can trust them to do that, and I'll be happy to talk about it with them tomorrow, because I know they'll call me if there's a problem. Or I can trust them to do that, but I'm going to need to be there beside them. Or no, I can't trust them to do it at all, I have to show them how to do it. They are natural decisions for us to make, I think, and I think that's, we're jumping to solutions a little bit, but I think that's, to my mind, seems to be part of where we should be heading. Because the more we can align the decisions we make about what we allow our trainees to do with the decisions we make about how they're progressing, the more those things can converge, the more likely we've got a workable system, I suspect. And there was someone over here, yeah.
And one of the difficulties relating to that, I think, is the different styles and expectations of supervisors within a department. So we've got some people who are very hands-on, and and are very don't provide much leeway for a trainee. They seem, in that context, they seem to be doing fine. Another person that is very hands-off, and then you start to uncover all these problems. We have same with knowledge. We have some people who expect that a trainee in the first year should know every paper and the first author by name, sort of thing. And others that are have a more flexible sort of approach to how much there is in the curriculum people need to know. So as a supervisor, you get feedback from all these people, and I find it very difficult to reconcile.
Yeah, I think it's a really good statement of a problem, isn't it? So how do I know that my expectations are the same as someone else's? That sort of fits in with the, it's a good point.
Again, I think harking back to the fact that there's a 3-year training program,
yep.
The consequences of failing someone can be enormous. They might lose they might not have a job.
Yep.
If it's on a rotation and everyone's all lined up and you've got someone to come and take your job, they can't just fall back and repeat a year. It's not like being in medical school. I mean, so the pressure on you to say, oh yeah, you're probably okay, is huge. Just from that perspective, from both the trainee consequence and the system consequence as well, that you have to have people moving through the system. So you need to be very firm and very sure of your position before you say to someone, we're actually not up to scratch. And hopefully you wouldn't get to the end of the year before you have to make that decision. That's the whole purpose, isn't it, of the formative assessment, is that you don't get that to the end of the year, but that's the consequence.
Yeah, you're touching on the stakesness concept. How high when the stakes are high, you have to be confident that you've got enough data to support your decision. And I think that to my mind is one of the big barriers. And I was using the analogy at this table, if you're trying to diagnose heart failure and the only data point you've got is whether they've got a third heart sound or not, then you won't be confident that you're making the right decision. Yes, it's helpful, but you won't have, and if it's a really important decision you've got to make, you won't be confident that you've got enough data to make that decision. But if you had the JVP and the edema and the CREPS and all the rest of it, then so other pieces of data and that fed into your decision, then your confidence would increase. And I think we see the same thing with our trainees. We see a high stakes decision needing to be made. Actually, they're not good enough. But what am I basing that on? It's just my judgment, or it's just a few observations. I don't feel confident that I've got sufficient enough data to make that really high stakes decision.
I guess that feeds into one of our other comments or discussions was, and it's a trainee, supervisor and system issue, but the lack of documentation of discussions with trainees and their supervisor. And again, that culture of timely and constructive feedback, so that you then have an action plan of whatever's identified early on or in multiple areas, and that can be as a really, I guess, a trainee that's really struggling, a trainee that's borderline, but a trainee that's doing well, and it's the culture that you expect that will happen. That also feeds on to one of our other discussions was the handover or lack of handover from supervisor to supervisor, and also the multiple issues about the successful access to previous reports being the only handover that supervisors get, and the reasons for that.
Really good point. Thanks. That's under the general heading of the paper trail, isn't it, I think? And that's a really important point you've raised. So once again, when it comes to a high stakes decision, we want there to be a reasonable paper trail to back it up. It's code for enough pieces of data is what we want to back up that decision. Yeah, I think it might be just useful just to perhaps slightly reframe the question. I mean, we deliberately said failure to fail. Of course, there's a lot of things that can happen before someone fails, so, and we don't want to forget that. So failure to help someone learn might be a nicer way of thinking about this. And you know, we obviously framed this question this way just to focus our thinking, but I don't think we should just think that the only thing we can do is pass or fail people. Of course, what we can do is we can provide people with information on areas that they can learn. And the more we do that, and the more receptive the trainer is to that, then the fewer people are going to fail anyway. So finding the areas in which they can target to learn is going to be very helpful to preventing them from failing. One of the things we, and Fred might want to comment, but what we've done at the medical student level in Otago is we've got this system called Conditional Pass, and if someone gets a conditional pass, what the supervisor or person making that judgment has to say is what are the conditions that need to be met in order for that person to pass. It's not a perfect system, but it's working quite well because once again it sort of ties into that natural language aspect. Generally speaking, if I ask someone, what would your trainee need to be able to do to make you comfortable that they're okay, you could probably answer that for me. You could probably tell me the answer. So the trainee who you're thinking is not doing quite so well, and if I said to you, what would they have to do to reassure you that they were doing okay, I'm guessing that you would be able to give me an answer to that. Now, if we converted that answer into what does the trainee need to focus on in their learning, that's a very small step. So what does the trainee need to do next? And then if we then converted that to saying, okay, and in a few months' time or whenever it's going to be, have they done that? It also becomes a relatively easy question to answer. So the supervisor 6 months ago said, for me to be confident they're going okay, they have to be able to do this. I'm not failing them, I'm not passing them, I'm just saying these are the conditions they have to meet in order for me to be confident that they are reaching the standard. And then a few months later or a few years later, whatever it's going to be, we can re-ask that question of the trainee and their next supervisor, have they met those conditions or not? Yes, they have, great, they passed. No, they haven't, they fail, and there's a paper trail.
So the current advanced training supervisors form has a box saying
Yeah.
what are the learning needs for this trainee for the next run or the future.
Yeah.
And I have to say, looking from the committee at those reports is often supervisors are struggling to articulate in
Yes.
any sort of specific competency what it is about the trainee that needs to improve. And I think that's where a clear framework
Yep.
of competencies will help. The other thing I was going to say is that it is a high-stakes decision, and as supervisors, we're trapped sometimes into putting greater weight on what we see as attributable mitigating factors, some personal crisis that's happened in the trainee's life sometime in the last 12 months. And even as a oversight committee, NZAMDEC has been trapped into attributing too much to a mitigating factor when actually it was a fundamental problem of the trainee's insight or learning. So I think having a framework would help that also.
That's a really good point. So, and it's another theme, isn't it? The mitigating factors thing. And I always think about the driving licence analogy here. So you went for your driving test and you crashed the car, but actually that was because I had a hangover and I was a bit sick the last week. So you should really let me pass. That's never going to happen, is it? What they'll say is no, go away and come back when you can do it, and go and get yourself fixed up. Come back when you're ready, ready to sit the test again, and do it then. Now, I'm not talking about sitting tests as such, but I think we have to be very wary about trying to figure out what someone might have done had circumstances been different. I think we're in safer ground actually seeing them do it.
I think the thing that has been alluded to a number of times, but we really need to grasp, is the enormous tension between what we call training and what they need to achieve during their training and employment. And the problem at the moment is that it's employment that is handicapping our capacity to train. Now, going back to the point that has been made earlier, if someone hasn't got a certain skill, they might need longer to acquire those skills. Not everybody acquires everything in 3 years. Or if someone has got, quote, a personal crisis that has stopped them from achieving what they need to achieve, that's sad, but they still need to achieve that.
Yeah.
We can't say just because you had a personal crisis, you can come out as a half-baked doctor.
That's right.
You can't have that. You can say, okay, you've had a personal crisis, therefore you need more time in order to achieve the skills that you couldn't achieve in the time you should have. But we can't do that to a large extent because our hands are tied by the employment cycles and about other trainees pushing up. So that's a real tension that we need to be able to, we can say to someone they need an extra year, but are they going to get an extra year?
Yeah, I don't have the answer to that one, but there is what you're talking about is the tie-up between assessment and HR. Aren't you? And the only thing I would say is that when we brought in this idea of conditional pass, people said, oh, that sounds like a performance review. And so I wonder if there is a parallel there. I mean, you know, our system is at the undergraduate level, so the employment issues don't apply. And I don't know how it would work in advanced training. It's a really good area to think about. But I wonder if, you know, in order for you to progress to the next stage of training, you need to meet these conditions. Feels a bit like in order for you to remain employed, you have to meet these conditions. But there might be nuances about that I don't understand.
A little bit of talk about the chronology and the time pressure, and people use 3 years, and I can't help but make the comment that a lot of the time it's actually 2 years with so many dual trainees in the system. And your first year supervisor's report comes out at the end of first year, which is effectively halfway through a lot of people's advanced training program. So we're under a very, very short and pressured system.
Yeah, it's a challenge, but we shouldn't use it as an excuse, should we? Because the training's never going to be long enough. Yeah, but you're right. Yep. I guess it heightens the need for a paper trail.
Oh, I was just going to mention, like, as a trainee, one of the other reasons to add is that even as a trainee, you might identify areas that you want to improve in and want more time in, but then the workforce might not ever let you do a rotation or whatever in that because everyone else needs to do it as well. So it might not necessarily be something that's stipulated by the college or your supervisor, but even as a trainee, you might want to do extra time and workforce impacts on that as well.
Yeah, actually that's a really interesting point. So you might identify that there's an area they need to improve in, and you all agree on that, and it's all very clear, and there's a nice paper trail, but there's just not an opportunity for them to learn that. And that's a separate thing again, isn't it? And I suppose there can be a temptation, therefore, to say, oh, yes, they need to learn it. No, we can't help them learn it, therefore we'll pass them.
So we identified another issue, which is sort of streaming of the trainees, which is that the best trainees go to the most popular sites that probably have the best supervision, whereas the weaker trainees will tend to stream to the less popular, probably smaller sites with the least experienced supervisors, and the issues that then leads to.
So do you think there's an inverse supervision law, like the inverse care law? The people who need the most supervision are the people who least get it, perhaps?
Yeah, I think that's true.
Yeah. I don't know what the answer to that one is.
Selection of trainees comes into this, is what Jeff has been saying, really. So if we have a national program of selection, then it modifies that weakest trainee to weakest supervisor. And to have a national trainee, then everyone gets assessed at the same level, at the same time, and then they are allocated to positions on merit.
So is that a selection thing or is that a training thing? Because it feels more like it would be matching the trainees to their training needs during the training, rather.
No, that's right at the start, of the training program.
I think also how you rotate people between jobs, and not having people sitting in one job for the whole time, actually getting them to move around and experience, so that the trainees who started off at the periphery do get the opportunity to go to the centre and be assessed by a different group of people, and the people who have started off at the centre can go to the periphery and see what it's like to work out there, which they may never have done.
So being a bit more directive about where people get their training opportunities.
Yeah.
I think that's what you're saying. Yeah, it's a good point. Okay, good. Yeah.
Some of us are actually doing that already with in Victoria with medical oncology. We actually have a training program, and rural hospitals are paired up with good training tertiary institutions, so that within 12 months they have a rural rotation and a quaternary or tertiary rotation within metropolitan Melbourne. But also the trainees get ranked in third year, second year and first year, and they will be rotated through seeing the rarer forms of subspecialised malignancies that you see at Peter Mac or the Royal Melbourne or the Austin in their second and third year of training. That allows for that. So I think some subspecialities are actually doing that already, allowing their trainee to get their breadth of training within their 3 years.
Sounds good scheme. I mean, you could. I'm not suggesting this would happen with your system, but it could perpetuate the inverse supervision law, couldn't it? If you had a system like that, you could say, yes, I've got the best unit in the country, therefore I want the best trainees.
It's not allowed.
Okay.
No, they're ranked.
You'd have to be mindful of that, wouldn't you?
Yep. Yeah, no, the trainees rank their preferences, and they're chosen on their degree of capabilities.
Yes, I guess what I'd add to that then, I think it sounds like a good system, what I'd add to that is probably what we should do is we should match them on their areas of, match the learning opportunities to their learning needs. So in other words, if there's a trainee who's having a difficulty in a particular area, for whatever reason, lack of opportunity, lack of ability, then you'd want to somehow incorporate that into the decision making, wouldn't you, about where they go next. So there's, their area of weakness is counted by them being placed in an area where they know they're going to get that opportunity.
It doesn't have to just be a question of what they need, but the variety or the diversity of experience. I don't know what it is in the past that we always used to say that no trainee could spend more than X amount of time in advanced training in one institution. That seems to, for some reason, have disappeared in some places. And in some places you've got trainees spending all 3 years in, and I think that's just bad experience.
Yeah, I agree.
Yeah, I think a varied diet's always a good idea, isn't it? Yeah. But I'm suggesting maybe even more than that, actually being quite sort of proactive in what you need more greens and less meat at the moment. Thanks very much.
Networking, I think, is often a way to achieve a lot of that.
Yep, or oversight.
I just wanted.
You thought of what you were going to say?
Remember, I just wanted to point out the difference in between telling somebody that you failed and telling somebody that you need more time. Yes. So I think the fact that our only option of giving people more time is to fail them is counterproductive, and I like the conditional pass or some other mechanism.
So in fact you don't want to do either. You want to tell them you haven't failed, you don't need more time, but this is the area you need to improve in. This is the area you need to get better at. And where we're not so good at the moment, I suspect, and correct me if I'm wrong, is being clear about what those various dimensions, what the various dimensions of the expectations might be. We might just have a sort of a generic one of you have to be a good advanced trainee, but we perhaps don't break it down into exactly what that means.
carry on from Matthew, most of us would have 24 months core. I think there's some areas that they need to do 36 months of training. But do the second year supervisors actually take it on board that maybe they need to counsel their trainee to do a third clinical year and discourage them from going into research? That maybe that need to be in their fourth and fifth year. You know, that needs to be, I think, encouraged as a second year supervisor. That maybe the trainee needs another 12 months of core training.
Yep. Once again, if it's dictated around their needs, it will become obvious, wouldn't it? If there's an area that they're strong and they don't need more of that, but there's something that we might be going to say that?
Changing slightly, but we had a bit of a discussion about who is actually, when we say about the failing, who is it? Is it the SAC or the committee we're talking about? We're talking about the supervisor completing the report. So, and it could be very different issues that are faced between the committee not failing somebody who might have an unsatisfactory performance and the individual supervisor, and there might be different issues there that we're not going to necessarily solve them both with the same things.
Yeah, that might be. You're good on the segues, Mike.
Sorry.
I'm
far from the crowd.
The bit I'll talk about in a minute is around the literature around failure to fail, or at least my interpretation of the literature around failure to fail, is I think there's an over-assumption that it's the supervisor's fault. It was all, you know, if only those supervisors would tick those boxes that say they're not very good, it will all be okay. And I think that sort of misses the point a bit. That it can be quite hard for a supervisor to tick some of those boxes for some of the reasons we just talked about. The stakesness of the decision, how confident are you that you've got enough data to support that decision, what are the expectations, and so on. So I think that's, yep, I think we can be unfairly blame the supervisors for what actually is a systems problem. And I think sharing the blame here can be quite helpful. So there's Brian Hodges, some of you may know, a Canadian who's sort of a world leader in assessment. He gave a talk on the subjective collective. It was a really, really good talk. But the point he was making is that we've sometimes historically thought that you can only be objective if you've got rigid things written down in tick boxes and so on. Whereas we now realise actually you can be objective. Subjective opinions can be very objective, provided you've got enough of them. So the collective. So you have a collective of subjective views is actually incredibly reliable. Often, you know, if everyone in this room looked at someone and said their professionalism wasn't very good, you're probably right. Now, what did you mean by the professionalism? You might find it harder to just decide, and that might not be quite so good for the trainee who's trying to work out what to do better. But your global judgment, if there's enough of you and you're all saying much the same thing, then you're likely to be right, even though each individual one might seem a bit vague. So I think that's, once again, I think that's a system where we need to get towards, where the sole subjective, the one person subjective, which is often what a supervisor finds themselves in, is a very uncomfortable place to be, because you don't feel that you're making very reliable decisions. You're feeling very much on your own, and therefore it's much, much easier to say, oh, they're probably going to be okay.
That's when I think we should foster a culture where it's a unit decision. You know, a supervisor within a unit at a public institution or private institution shouldn't be made to feel that it's their sole decision. They need support from their colleagues, from their head of unit, from medical workforce. It should be really a united decision, and there should be communication between all those levels.
I completely agree. I'd actually go one further than that. I would say it should be possibly statewide, or, you know, I think it would be easier. There was an anecdote from our table. I'll anonymise the centres and anonymise the discipline, but someone said, oh, trainees from that city would never get a job in my city because they don't know how to train them properly in that city. I'm sure that never happens, but that was the anecdote that was given. Now, you know, clearly that's a bad statement, isn't it? You know, let's think of all the reasons why that's a bad statement for people to say and what it reflects. But if you had people from that other city contributing to the decisions about the people in the first city, that might get away from that a bit, and it also makes it slightly easier. So, you know, let's pretend it's my trainee in Christchurch, and I think they're going okay, and then Mike, who's in Wellington, says, well, I'd never pass them in Wellington. I'd say, oh really? And why is that? And we'd have a conversation, and we might agree, and then I'd feel more confident. Okay, you're right, this guy shouldn't pass. And when we come to make that decision to tell him or her, I can say, actually, I thought you were doing pretty okay, but actually, I was wrong. You know, I've talked to all my colleagues, and no, you're not quite ready yet. To my mind, starts to feel like a more comfortable, I mean, they're all uncomfortable conversations, but it starts to feel like a more comfortable decision, rather than it's just me telling you that I don't think you've got to the right standard just yet. So I'd go one step further than what you're saying, go outside the cities, outside your hometown. Good. Well, look, I'll just talk about a few things, just a little bit from the literature around this. This is just some ideas I've had around some of the problems. I think we've touched on quite a few of these already. The first one is that the trainee has two roles. There's conflict of roles going on. So the trainee has a role as both a learner, and they have to self-assess. And we know that people aren't always good at self-assessing their own ability. And we also know that people tend to subconsciously or otherwise avoid the areas in which they know they're weak. Sometimes that's adaptive, but often it isn't. When you're trying to learn, it's not that adaptive. So that's one area. That's a conflict for the trainee. I think the next two are the nubbin of the problem, to my mind. I think this is a real difficulty for supervisors that contributes, in my view, to a lot of the failure to fail, and that is that the supervisor has to be both the guide to the candidate, the trainee's learning, and has to be their judge. And that's fundamentally quite different roles. When you're trying to be their guide to learning, you are forming a relationship. You have to form a relationship with them to help them with their learning, and that's a very good thing. So you get to know them, they get to know you, you work on things together, you get to understand each other, and you work effectively together, and you gradually, you know, give them more responsibility and so on. That's a very good thing to do. The next day, you've got to turn around and say, oh, actually, you're not good enough, is a very uncomfortable position to be in when you've been, in a sense, their friend up to that point. So that's quite a difficult position, I think, for a supervisor to be in. And which leads on to that next one, which is when there is a problem and they haven't quite hit the mark. Is it me or is it them? So they haven't quite got the right standard. Actually, I probably should have given them a bit more supervision. I probably should have done a bit more of this or that. I should have given them more opportunities. Yeah, I'm not being a very good supervisor. But gee, it's not the trainee's fault. That was all my fault, so I better pass them. You know, it's I don't know if it happens to you, but it certainly happens to other people. Once again, it's a difficult position to be in. And certainly the trainee will play on that if they want to. So it's your weak point already. You think, is it me or is it them? And the trainee might well say, oh, it was you. I don't know if that's ever happened to you either. Possibly has. And you know, they're getting you right where it hurts. Because that's the weak point you've got. So I think that to my mind, they're really big issues. And then just as we were putting this all this day together, a paper came out, just a medical teacher, just very recently, where they actually surveyed a whole lot of people in the States around failure to fail, and interestingly, very similar themes. So the first one we've talked about, that there's not enough information to be confident, only seeing part of the picture. So that's that whole thing regarding the stakesness of the decision and sufficiency of the data. So there's a high stakes decision but insufficient data, therefore you don't feel confident about doing that. We've heard that one before, they've come this far. So, you know, they scraped through first year, they scraped through second year, third year, gosh, they're not very good, but boy, you know, they've come this far. Let's just pass them. Postponed too late, sort of the same thing. So the news comes as a surprise. There's no paper trail. there's not been any conditions set, let's say, for where they have to focus their learning. And of course the biggie, which actually hasn't come out, but I'm sure it's there, and I'm sure you've all got your own scars, or some of you will have your own scars from these occasions when you have tried to fail someone, and the avalanche of paperwork that comes your way, and the appeals and all the rest of it can make it very, it just makes all those other things that you're feeling uncomfortable about, make you feel even more uncomfortable about, particularly around the reliability of the sufficiency of the data to make your decision. So that's some of the stuff in literature. I don't know if there's other points that people have got, or other reflections that people might like to make around that. So any last minute comments before we separate you from lunch? Yes.
One thing that hasn't come up is the difference between being a mentor and being a supervisor, and the conflict that I feel the person that my role is to encourage people. Failing them is not a good way of encouraging them. So there's a conflict there.
Yep. So your role is you can be a role as their clinical supervisor, so making sure that they're safe with your patients and learning all the stuff. That's a pretty clear role. But then there's another role about like giving them career advice or where they're heading with their, that's good. And they sometimes line up, but often they don't. Yep.
One of the issues I think that a lot of supervisors grapple with is how to undertake remediation. If you've got someone who hasn't got certain skills, what kind of remediation can you do? Have you got the time to do it? And where are the resources to do it? And I think one of the things that the college might look at developing is some remediation modules. I mean, obviously it can't address everything. There might be certain skills, however, that you could actually develop remediation modules to, and the supervisor can say, look, you don't know very much about something or other. Here's a module that you can look at, and let's come and discuss it together. We need resources to help supervisors. Otherwise, it's left all in their own basket.
It's a whole new topic, isn't it?
Yeah.
Marie-Louise might do that for another session or something, I'm not sure. I mean, I think you're right. If put another way, if you knew there were pathways for them to be put in, you might find it easy to put them in those pathways. Yeah, I think that's a really good point. Thank you.